Hello and welcome back to Introduction to Clinical Laboratory Science. My name is Dustin Scott Brewster, and this is going to be the third of a three-part presentation for the first unit of this class. Now, I want to recap what we discussed in the first two units. So, in the first unit, we talked about the history of medical laboratory science and major milestones throughout history to achieve where we are now. We also talked about the definition of clinical laboratory science. What is clinical laboratory science? That is providing analytical data for the purpose of making medical decisions. Just a quick overview. Then we talked about accreditation for institutions where laboratory testing would be performed. So a hospital would likely have accreditation through the College of American Pathology. If it's a smaller clinic or doctor's office, they may have COLA accreditation, which is the Commission on Laboratory Accreditation. We also talked about institutions where people are being trained to become medical laboratory technicians or medical laboratory scientists. Those academic institutions also need to be accredited. They would be accredited through NACLS, the National Accrediting Agency for Clinical Laboratory Science. We then talked about certification or accreditation for personnel. So healthcare providers usually need a registration, certification, or licensure to practice in their field. Next, in the second presentation, we talked about where you may find a clinical laboratory, whether it's a hospital, a doctor's office, a clinic, a reference lab. And then we talked about the organization and workflow of a common lab, such as specimen processing, and then you would have chemistry, serology, immunology, hematology, coagulation. So we gave a brief overview of those. We'll break those down in much more details in the fifth unit of this course. So for now, let's move on. And I want to continue to talk about the personnel that you would find in a clinical laboratory. So the first person I'll mention, or the first type of personnel I'll mention, is a phlebotomist. These people are responsible for collecting blood, but also collecting other specimens type, transporting and receiving them in the clinical lab. To become a phlebotomist, you need a minimum of a high school diploma or equivalent, and it's preferred to have a certification and to be ASCP Board of Certification certified. Now, in order to do this, you would need to take a accredited program or go through an accredited program and then sit and take your ASCP Board of Certification exam. So you would have to go through an accredited program such as the one at Austin Community College. Once you complete that and meet the minimum requirements, then you can sit and take your board of certification exam. So I highly recommend anybody interested in becoming a phlebotomist to go through the phlebotomy program. For the next person, a medical laboratory technician, these people perform the analytical tests in a clinical laboratory. To become a medical laboratory technician, you need to have a 2-year degree from an accredited community college or technical college, such as Austin Community College. So these are typically 60-hour programs. The first 30 hours are going to be prerequisites. The next 30 hours, which is usually a 1-year program or fall, spring, summer type of setup, then you would take the course specific program or course specific classes like immunology, blood bank, chemistry. Once you complete that program from an accredited institution, then you could sit and take your ASCP Board of Certification exam to be a certified medical laboratory technician. The next person I'll discuss is a medical laboratory scientist or a clinical laboratory scientist, sometimes called a medical technologist. That's all the same thing. And that's a person that has completed a 4-year bachelor's degree from an accredited academic institution. And there's various ways to break those programs down depending on where you go to college. So most programs are going to have a 2+2 program where you'll have 2 years of prerequisites and then 2 years of core classes like chemistry 1, chemistry 2, blood bank 1, blood bank 2, such as that. They can also have a 3+1 where it's 3 years of prerequisites and 1 year of core classes, or a 4+1. Usually these people already have a bachelor's degree and then they'll take a fast track program through a MLT or MLS program and then be eligible to take your ASCP Board of Certification exam for medical laboratory science. So after you've gained several years of experience as a medical laboratory technician, a medical laboratory scientist, and if you work in a busy or big enough hospital, you may be able to specialize in one of the core departments. Now, this isn't going to be as common to see a specialist in a smaller rural hospital. Those facilities are more likely to have generalists, where you have an MLT or an MLS working all of the benches. But a bigger urban area, they're more likely to have specialists. So after you become a medical laboratory scientist from a 4-year degree program and you want to specialize, you get several years of experience in that department, and then you have eligibility to take your board of certification exam for that discipline. So you can specialize in blood bank, hematology, micro, or anatomical pathology if you are in a big enough hospital and the need to specialize is there. So after we have the operators performing analytical tests, that would be the medical laboratory technician or medical laboratory scientist and possibly the specialist, then we get into management. And the different types of management that you can see in a clinical lab could be a laboratory or department supervisor. This is going to be more common in a bigger hospital where a supervisor for one department is necessary. Again, if it's a smaller hospital, it may not be necessary to have a department supervisor or a lab supervisor. These people are usually in charge of a specific department and ordering reagents and keeping track of all of the maintenance and quality control and quality assurance for that department. That's a lab or a department supervisor. A lab manager usually oversees the personnel itself. They're responsible for making the schedule and bringing everything together, all the departments together as a whole. The laboratory director is going to oversee the entire hospital and possibly serve on committees or panels to make sure that the hospital is in compliant and they're meeting all of the regulations mandated by the Department of Health and Human Services, which I'll bring up here in just a second. And the laboratory is going to make sure that the laboratory director is going to make sure that the lab is compliant and meeting all those minimum criteria. A medical director is necessary for actually signing off on all of the tests because the purpose of clinical laboratory testing is to make medical decisions, just to provide data to make medical decisions for a patient's health. We need a medical doctor to sign off on all of those orders. So that would be a medical director. Now, because we have CLIA, or the Clinical Laboratory Improvement Amendment of 1988, I mentioned this in the history of clinical laboratory science. This is going to be a tool to establish a uniform way of performing all laboratory testing or clinical laboratory testing. And that is laboratory data that is for the purpose of making medical decisions. So diagnosing, treating, monitoring the health of patients. That is clinical testing, and we have to meet CLIA standards. So who is going to oversee CLIA regulations? Now that's going to fall under the Department of Health and Human Services. The Department of Health and Human Services is going to oversee 3 agencies that are going to provide the regulatory requirements for clinical labs. And I'll break these out here in just a second, but they're going to include the CDC, the Center for Disease Control and Prevention, CMS, the Center for Medicare and Medicaid Services, and the FDA, which is the Food and Drug Administration. The reason we have these regulatory functions is because we want to safeguard the public health and make sure that all of these practices are providing routine, safe, reliable, and reproducible results for the purpose of making sure people stay healthy and stay safe. Now, the first department I'll mention is the Center for Disease Control and Prevention. Now, the CDC is going to be responsible for tracking and monitoring disease outbreaks. So if there is an incident of Ebola or COVID or HIV, the CDC will be responsible for tracking that data so we can help monitor and hopefully prevent the spread of that communicable disease. So they're also going to track and mandate immunizations and what we need to do in the workplace to keep not only the patients but the healthcare workers safe. And then, of course, they're going to also monitor international disease transmission and the outbreak or spreading of any toxic substance. So, if there is a contaminant or there is something in the water, the CDC would be responsible for tracking that. So, occasionally, we have power outages in water treatment facilities. The CDC would be responsible for tracking that information to safeguard the public health. The next agency that falls under the Department of Health and Human Services is the Center for Medicaid and Medicare Services. Now, they're going to be responsible for administering coverage for Medicaid and Medicare, and their role in clear regulation is going to be to issue regulation and handle certification and set quality standards for clinical laboratories. They're also going to enforce HIPAA policies. So the Health Insurance Portability and Accountability Act, they're going to be responsible for mandating and setting those standards. The next agency is the Food and Drug Administration. The FDA, they're going to monitor the safety and effectiveness of the laboratory testing that we're providing in the clinical lab. So they're also going to determine the complexity of the testing. Now, I mentioned this previously. We have different types of laboratory complexity in the lab. We have wave testing, moderately complex, and highly complex testing. So the FDA is going to look at each clinical test performed in the lab, and they notate a number of things like how many steps does the test take, does it require manual interpretation, things like that, and they'll assign it a complexity level. So those complexities are waived, moderately complex, or highly complex testing. So for wave testing, the FDA is going to be responsible for assigning who can perform wave testing. So wave testing is a very simple test that doesn't require any type of sample manipulation. And what I mean by that is whenever a sample is collected, I mentioned this in the last presentation, it goes through specimen processing. If it has to be spun down, that is considered a manipulation and it would no longer be considered a wave test. If I don't need to do any type of manipulation and I can just immediately run the test on the sample I collected, it most likely is going to fall in the wave category. And for that reason, the requirements for performing wave testing doesn't have any special certification or education requirements. These people are often trained on the job. For moderately complex testing, this is going to require usually some type of manipulation or a number of steps that are going to exceed the minimum qualification for wave testing. So if I have to spin the sample down and then test the serum or plasma, the liquid component of the sample, this may fall under a moderately complex test. For that reason, we want to make sure that the personnel doing this testing has a little bit more training. So generally, these people are going to have a minimum of a high school diploma and 50 weeks of military training or appropriate documentation. For highly complex testing, this is going to require several more steps and sometimes manual interpretation of the result. Now, what do I mean by that? Now, if I have to spin a sample down, I have to separate it. That requires a lot of steps. That requires manipulation of the sample. Then I go on to test the sample. If the result for that reaction requires me to make a manual interpretation, did it clot? Did it not clot? Did the color change? Did it not change? That's manual interpretation. A lot of times these tests will fall under highly complex, and for that reason will require a minimum of an associate's degree from an accredited MLT program. So we will need some additional training for that testing. Different types of professional organizations. Now, certification, accreditation, and professional organizations. For certification for laboratory testing, the gold standard is going to be the American Society for Clinical Pathology, where they have board of certification exams for phlebotomists, for medical laboratory technicians, medical laboratory scientists, and specialists. You can also get certified through the American Medical Technologists organization or agency, and also the AAB. But I will say the ASCP is probably the most common and the most widely recognized certification program. Now let's talk about confidentiality. Now, we mentioned this a second ago. We were talking about the Center for Medicare and Medicaid Services. They're going to enforce HIPAA, and HIPAA is going to mandate confidentiality to make sure that patients' information stays protected. So, in order to work in a clinical lab, you have to be HIPAA compliant and you have to know that patients have the right to have confidential information withheld or a need to know basis. If I'm working on that patient's sample, I have a need to know. If I find an interesting case or I'm working on a patient sample that is famous and I want to discuss it with my friends, that would be a HIPAA violation. So you have to have a right to know that information in order to be HIPAA compliant. So if somebody comes in and asks for their information, you would have to send them to patient records. You would not want to give that to that person. That could be a HIPAA violation. If somebody calls on the phone and asks for information, that could be a HIPAA violation. So you want to make sure that you're providing confidentiality and protecting those patients' rights. So, what exactly is the HIPAA Act, the Health Insurance Portability and Accountability Act? So, it was passed by Congress in 1996, and the purpose is to protect patient privacy. Now, what is considered protected health information that could violate HIPAA? Now, anything that can identify somebody individually, that is protected health information, and that would be protected under the HIPAA Act. So things that are protected would include a patient's name that could identify somebody, their date of birth, geographic identifiers, maybe they live in Austin, Texas, or Lubbock, Texas, or Rochester, Minnesota. Their phone number, now that is a unique identifier, and their email. So all of those are just examples. There's several more, but those are just some examples of protected health information that would fall under HIPAA.